This is Paul Pearson, host of Star Time. And when I'm not explaining to my intern exactly what R&B is, I'm listening to Rainier Avenue Radio.world.
You probably have questions about COVID vaccines. Here are some answers about how they're being made.
How are COVID vaccines being produced faster?
Usually, vaccine testing and production are separate steps. But because of the pandemic, vaccines are being developed on parallel tracks. So both steps are happening just at the same time.
How are the vaccines being tested?
Right now, several different COVID vaccines are in testing. Each go through multiple clinical trials with up to thousands of volunteers.
How do vaccines get approved?
Not all COVID vaccine versions will make it to the final stages of testing and approval. Produced vaccines that do not pass clinical trials will be destroyed. But for those that do pass, a team of medical experts will examine test results and possible side effects. If the vaccine is effective and safe, it gets approved and gets to you. Go to covidvaccinewa.org to learn more. A message from the state of Washington.
The beat of the Fox with nastiness is back on K-Fox Night Beat.
Yo, what's the deal? It's the legendary Hall of Fame DJ Mixmaster Ice from UTFO.
What's up? Who you thought this is? This is Sir Mix-a-Lot.
And this is Terry Lewis.
And I'm Grand Mixer GMS.
What's up, y'all? This is DJ Third Degree.
This is JJ Hudson from the High Children family.
Sunday nights from 9 p.m. to 11 p.m. Pacific Standard Time. It's K-Fox Night Beat with DJ Nastiness.
Bringing back the memories.
Bringing back the memories.
Bringing Seattle's hottest music.
Bringing Seattle's hottest music. Rainier Avenue Radio.world.
That's my noise.
Peace.
My name is Keith. I'm a barber from Tacoma, Washington. When the pandemic hit, it did affect me as a business owner. I had my own personal reasons why I didn't get vaccinated. But I was talking to a doctor, and he was telling me more about what it could do to protect us and our family. I wanted to get back to that once was, right? I do feel safe knowing that I am vaccinated. I just hope what I'm saying is reaching into people's heads to know that this is the best decision for all of us. To learn more, please visit hereforuswa.org.
Rainier Avenue Radio, your community radio station will provide you with more information. Rainier Avenue Radio.
You're tuned into your community radio station, Rainier Avenue Radio. This is Daniel Bellis from the Rainier Avenue Radio studio. We will be bringing you live coverage of the press conference by Dr. Jeff Dushin, King County Executive Dale Constantine, and Seattle Mayor Bruce Harrell. As soon as their press conference begins, they'll give you some updates on King County vaccine verification policy as far as where they're standing on that right now. They'll be bringing their press conference in any minute now. So until then, wait up and tell you about a couple of programs we have coming up here on Rainier Avenue Radio this Thursday. We have a lot of programs for Black History Month this month. And this Thursday, we'll have another panel for you. This will be a panel on Blacks in Tech. It's hosted by Al Heron, and it is an examination of all tech issues with guest LaShawn Smith and Susan Bachman-Rose, discussing the history of technology, including Blacks in Tech, the Black Technology Pipeline efforts to create more Blacks in Tech, and the future of Blacks in Tech. And that's tomorrow at 5 p.m. right here on Rainier Avenue Radio. Check your local listings, Facebook, YouTube, Twitch, Twitter, all that. And be broadcasting live tomorrow at 5 p.m. Blacks in Tech. Also, coming up, Rainier Avenue Radio will be broadcasting the Sea King District Boys and Girls Championships for this for 3A. And those will be going down on Saturday, 6:30 for the boys p.m. and 8:15 p.m. for the girls. Check that out. Saturday, 6:30 for the boys, 8:15 for the girls. Sea King District Sea King District 3A Boys and Girls Championships there for you. Next week, a lot of Black History events coming up for you, including on Monday at 5 p.m. There will be a panel on Black health and wellness that'll be broadcasted live from MLK Memorial Park. Also in our Black History Month coverage, that's Monday at 5 p.m. And then on Tuesday at 11 a.m., there will be a Taswira African workshop with crafts for kids and learning all about that. Tuesday at 11 a.m. And the festivities continue that evening as there will be a live performance of Bob Loveless and Friends next Tuesday at 7 p.m. There will be a panel discussion on Blacks in Trades next Wednesday, hosted by Mark Scally, How to Be Your Own Boss. And there will be another panel, Blacklash, on next Thursday. The next Thursday being the 24th. An Eastern Washington affiliate's going to help host a panel discussion on the topic of Blacklash. There will be an old school music party on the 24th of Thursday next week at 8 p.m. until 10 p.m. And then there will be a Black Wall Street Gallery and opening ceremony on Friday featuring authentic memorabilia from Tulsa's thriving Black Wall Street prior to the massacre, and accompanied with stories of Black women who are an essential part of the business community. There'll be a vendor fair that'll take place on Saturday, live from the Columbia City Theater. An exhibition on Saturday as well with guest speakers, Tulsa descendants of Black Wall Street business owners. That will go into Sunday, the 27th. And that will conclude Rainier Avenue Radio's Black History Month coverage. Again, you're listening live to Rainier Avenue Radio, your community radio station. We'll be going live shortly to Public Health Seattle and King County's press briefing featuring Dr. Jeff Dushin, King County Executive Dow Constantine, and Seattle Mayor Bruce Harrell as soon as they begin their press conference. So until then, stay tuned. We're going to give you some R&B music for you. And we'll check in with you if they haven't started. Until then.
Good afternoon. Thank you for being here today. I'm King County Executive Dow Constantine. I'm very pleased to be joined by Mayor Bruce Harrell of the City of Seattle and by our County Health Officer, Dr. Jeff Dushin. It's been 5 months to the day since we first announced our local health order to require proof of vaccination to enter certain businesses and venues across King County. Back then, we had reached a critical moment in our long fight against the pandemic, one that would determine how quickly and how safely we could emerge. Hospitals were at their highest occupancy rates, and the Delta variant was continuing to mutate and strengthen. So we decided to adapt as well, using effective tools available to ensure that we could keep people safe and keep businesses open. Vaccination verification, along with masks, along with testing and other measures, has helped us reduce the risk of exposure to COVID-19, to protect people, and to move our economy forward. King County is among the best vaccinated major jurisdictions in the country, with nearly 2 million of our friends, family, and neighbors taking the steps to keep themselves, their loved ones, and all of us safe. The statistics are currently that I believe upwards of 85% of the population 12 and over have been fully vaccinated, and a very large percentage of those folks have gotten their boosters. Now, with that kind of success, we are entering another critical period in this ongoing pandemic. recovering from the Omicron variant stage. Thankfully, the outlook is hopeful. Following this major surge in infections, this major surge in hospitalizations, COVID-19 cases and hospitalization rates are decreasing. Our vaccination and booster rates continue to increase at the same time. So let's be clear. We are not entirely out of the woods yet, but there is a clear path forward. Our success in vaccination and decreasing case counts and hospitalizations are why today I can announce that we will be lifting the local health order that requires proof of vaccination to enter certain businesses and venues beginning March 1. Now, while King County is lifting this requirement, businesses and organizations may still choose to continue requiring vaccines to protect themselves, their employees, their customers. And we support them in that choice. Dr. Duchin will be providing further details in a moment on why now is the right time to move forward with announcing this policy change. But it's important that we all acknowledge that this does not mean that the pandemic is over. It means the current state of COVID-19 in the county indicates that this policy is no longer needed as one of the key strategies to protect our community. We've had to pivot and shift strategies throughout the pandemic based on science, based on evolving conditions in our community. Our COVID-19 guidance and policies are meant to be reviewed and adapted to reflect our current reality. That is why we are also announcing that both county and city employees will start heading back to their offices in March. The county's departments are now working to implement what we call our future of work plans, which set out how services will be delivered moving forward, whether that's in person or remotely or a hybrid. While today's announcements offer us encouragement that the pandemic is moving in the right direction, we must continue to work together to ensure people are getting vaccinated and boosted if they are eligible, and that we follow additional prevention guidelines. I want to thank our public health professionals, community, our businesses, and all of our frontline employees for all they've done throughout this long pandemic to ensure that we stay safe and healthy. And now it's my pleasure to introduce to you Dr. Jeff Duchin. He will speak to the current COVID-19 situation and provide some further details related to the lifting of this policy. Dr. Duchin.
Good afternoon. Thank you, Executive Constantine. On September 16th, 2021, we announced King County's COVID-19 vaccination verification requirement. At that time, we were near the peak of the Delta wave that was causing significant stress on our healthcare system, and we anticipated increasing COVID-19 transmission during the subsequent fall and winter. The requirement was designed to be a time-limited additional layer of protection with the goal of decreasing the spread of COVID-19 in high-risk indoor settings and to help reduce the burden on our hospitals while allowing opportunity for more people to be vaccinated. 3 months later, in mid-December, before we had recovered from Delta, we were hit with the record-breaking Omicron surge. My health order at the time specified the vaccine verification requirement would expire on March 16, 2022, or sooner, based on the status and health impacts of the outbreak. Therefore, today, based on the evolving status and health impacts of the COVID-19 outbreak, we're announcing King County's vaccine verification requirement has served its intended purpose and will be discontinued effective March 1st. Now, with respect to COVID-19 outbreak status and impacts, since the peak of the Omicron surge in early January, both COVID-19 cases and hospitalizations have been falling, although they remain well above pre-Omicron levels. And stress on our hospitals has improved significantly. With respect to providing opportunity for more people to be vaccinated, since vaccine verification was announced, a total of over 250,000 King County residents have been vaccinated. including about 100,000 5 to 11-year-olds, and over 200,000 of these people have completed their primary vaccination series. Today, nearly 80% of all King County residents, including 88% of adults, have completed their primary series, and 92% of all who are eligible have started or completed the series. Now we need everyone who's vaccinated to get their booster when eligible for the best possible protection against hospitalization and death. And as with much else related to this pandemic, I have a nuanced message today. First, it's important to recognize our vaccination rates, our COVID-19 disease trends, and ending the vaccine verification requirement represent real progress. At the same time, and as hard as it is to hear, and as much as I don't like to say it, we're not done with COVID-19. And together, we need to keep moving in the right direction because cases, hospitalizations, and deaths today remain too high. For example, it's great that our cases are down 25% in the last 7 days, but at a rate of 375 cases per 100,000 people over 7 days, and over 1,200 cases reported daily, we're still at a level that's 6 times higher than the number that we had on Thanksgiving. It's also a tremendous relief that hospitalizations have dropped by about 2/3 since the Omicron peak. Yet, over the past 2 weeks, there have been between 20 and 26 King County residents hospitalized every day. That's someone hospitalized every 60 to 75 minutes, 24/7. Now, hospitalizations now are just a bit below the peak we saw during the Delta surge and comparable to the peak of the Alpha surge in the spring of 2021. And they're 3 times higher than the level of hospitalizations that were occurring on Thanksgiving. The 14-day average number of COVID-19 related deaths has also decreased 18% in the past 2 weeks, yet it remains above the peaks of both the Delta and Alpha surges. Nonetheless, all of these indicators are continuing to head in the right direction, downward. In addition, the large number of people who were infected during the Omicron surge will also likely result in some additional community immunity, at least for the short term. But because we don't know how long immunity from infection lasts, or have a way to measure it or test for it in individuals, and because vaccination improves the level of protection even after infection, vaccination is recommended for everyone, even those who have been previously infected. I also want to add my thanks to those of Executive Constantine, to those in our business community and our frontline workers for their efforts to implement King County's vaccine verification requirement, and also to our community members who supported the vaccine verification process. I also again want to thank everyone who's been vaccinated and boosted when eligible for taking this most important step to protect yourselves, your loved ones, and our community. Overall, things are improving and disease rates are continuing to decline, and I am optimistic that over the long term, we're headed towards a time when COVID-19 will pose less of a threat to individuals, to our healthcare system, to our society, and our economy. With your continued help, I hope we will arrive there soon. Some have characterized our current situation as the transition from a COVID-19 pandemic to an endemic state. And regardless of when one thinks that transition occurs, simply using the term endemic does not really help us know what we can expect with respect to severity, frequency of surges, seasonal patterns, or overall impact on the population. What endemic does imply is a more predictable range of severity, temporal occurrence, and impacts. We just don't know with certainty at this time what that endemic state will look like or when it will arrive. For this reason, we need to continue to limit the impact of COVID-19, both today and going forward, using the increasing number of tools that are available to us and with sustainable strategies that we can live with. I want to close by reiterating that lifting the vaccine verification requirements signals pandemic progress, but not pandemic over. We need to be mindful of both our vision for where we want to be, as well as the reality of where we actually are in the course of this pandemic. Today, we need to continue to use layered COVID-19 prevention precautions to help reduce the risk of infection and its serious impacts. This means businesses, organizations, and public spaces should continue to improve indoor air quality through ventilation and air filtration, one of the most important strategies that can make a difference no matter what COVID-19 variant may emerge in the future. Businesses and organizations should continue to support vaccination for their employees and their families, and help employees to stay home when sick. For individuals who are unvaccinated, please consider getting vaccinated. And for those who are vaccinated, get boosted when you're eligible for the best protection. When possible, limit time in crowded indoor settings, especially ones that are poorly ventilated. Continue to wear high-quality respirators and well-fitting face masks. Isolate away from others if you are ill, and test if you have symptoms or are exposed. These strategies provide the multiple layers of protection that we continue to need while COVID-19 is spreading at high levels. But if cases and hospitalizations continue to fall and our hospitals recover and stabilize, as we all hope they will, we will reassess the need for other policies, including indoor mask mandates. With that, I'd like to turn the podium to our Mayor of Seattle, Mayor Bruce Harrell, and then I'll be happy to take questions.
Thank you, Dr. Duchin, and thank you, King County Executive Constantine, for allowing me to join you. So at the City of Seattle, quite candidly, we are very proud to once again collaborate with the county and follow their lead and follow the science. I'll share a few thoughts with you about the City of Seattle's strategy relative to our employees. But again, as Dr. Duchin said, this is cautious news. This is good news. But of course, we are not out of the woods yet. This steady decline in positive cases is indeed much needed positive news. And as we approach spring, I think we should feel optimistic about hopefully where this COVID sort of crisis is going, but we can feel good about how we've dealt with it here in Seattle and the county and our state under Governor Inslee, and how we're dealing with it in the City of Seattle. With respect to the City of Seattle employees, we've actually had about 65% of our employees, roughly 7,000 employees, who've continued even through the pandemic to do provide in-person services for the last 2 years. This would include our staff who maintain parks and who keep the power on at City Light, our road workers working feverishly there, our police and firefighters who respond to emergency calls, and critically and very importantly, our Seattle Fire Department, our firefighters who've administered vaccines to our most vulnerable. As Dow Constantine said, starting mid-March, following the science, our departments will begin to bring more than 5,000 employees who've been remote back to the offices on business needs and work plans. We have put in place alternative work arrangements, AWAs, that still will allow some remote and hybrid arrangements to ensure that the Seattle residents, their needs are met. In-person customer service counters will continue to remain open, but we still will allow some level of flexibility. But basically, we think with the science leading us to where it is leading us, that we can start coming back to work safely. With over 90% of our residents, again, having received their first dose of the vaccine, we're moving toward a pivotal stage in how we're dealing with this crisis. And again, this is much needed news. Again, we will continue to look at following the county's lead, the disparities between vaccination rates between people of color and non-people of color. We'll look at that closely and do everything possible from the City of Seattle, including our mobile strategies, to make sure we address that. But once again, this is much needed good news, but certainly not by any stretch of the imagination reckless in nature. We're cautiously optimistic about the direction we're heading and look forward to following the county's lead in this regard. Thank you very much.
Well, thank you, Mayor Harrell, and you and I will do our best to answer questions, but as we said, we are following the science, and so we're going to center the scientists here as you have questions about not only the vaccine mandate, but our additional measures that are still in place to help protect the community against COVID infection. Please go ahead.
Yeah, I had a question for Dr. Duchin. Right now, especially here in the state, from the state level, here at the county level, there's a lot of communication in our community, in the Black community, talking about get vaccinated. You know, I mean, we're a laggard and all the numbers and everything else. With this news coming out today, the vaccine card is no longer going to be required. A lot of people in our community, they were like, we'll wait out the club, who are hesitant. And most aren't anti-vax, by the way, they're just hesitant. They're like, we'll just wait out the club, we'll wait out the restaurant. Now, March 1st, the card's not required. But what do you have to say directly to people in our community as to why they should still consider getting vaccinated, and they'll be able to move around the county without a vaccination card?
Thank you for your question. It's, I think, a nice thing that people can, move about the county, but it's a much more important thing to stay out of the hospital and to stay alive. And so what we know is that COVID-19 is a serious illness. If you're unvaccinated, you're not only several times more likely to be infected, 3 times more likely to be infected, 15 or more times to be hospitalized, well over 10 to 20 times more likely to die compared to someone who is vaccinated and boosted. So the most important reason to get vaccinated is to stay healthy and stay alive. But there are other reasons, because you may be in contact with someone who's highly vulnerable. And if you're vaccinated, not only are you less likely to become infected, but you're less likely to spread that infection to others who might be susceptible to severe illness, to hospitalization, or to death. And then there's the issue of long COVID, something we don't talk enough about. Even mild infections can result in serious long-term symptoms, chronic disease, cardiac symptoms, pulmonary, lung symptoms, neurological problems, brain fog, fatigue. It can be very debilitating. And so even if you say to yourself, well, I'm young and healthy, I don't think I'm going to land in the hospital, and the odds are in your favor, you still may develop long COVID, and it's very much worth not doing that. So there are many reasons to get vaccinated beyond being able to go and grab a bite to eat with others.
More questions here, then we have a couple that are submitted, and then we'll get back to the questions in the room.
Yes, Dr. Duchin, as you said, the case numbers, the hospitalization numbers are now still either at or higher than the fall when this policy went into effect. What's the simplest explanation as to why now is the right time to take away this policy?
The conditions are very different. They're heading in a different direction. Our healthcare system is in much better shape. Things are improving rather than at the time we implemented this policy. We were very concerned that things were on the uptick and worsening. We also have, like I said, over 250,000 more King County residents vaccinated, so we're more protected as a group. 80% of all King County residents, almost 90% of all adults are now vaccinated with the primary series. So we're much higher level of protection than we had back in September. The Omicron virus is different than the Delta virus. It's a different situation altogether with respect to preventing transmission. Don't forget booster doses, which we now are, part of our routine vaccination series, were not required or on the horizon when we announced this policy. So, we're policy at the time checking for the primary series 2 doses. Now it's a booster dose is what you need. So there are both scientific and logistical reasons why this policy is really no longer necessary at this point.
First, because how much you're expecting things to decrease in the next couple of weeks? Is that simply for alignment with other policies? Some people will see these declining cases and go, why not get rid of it tomorrow?
Yeah, the conditions in the community are sufficient to no longer need this policy today, but we have worked with our stakeholders who wanted a transition period so that they could work with their staffs or customers and just prepare, for a formal transition on the 1st.
So I have a couple questions submitted. And first for Dr. Duchin from Univision. As health officer, what would you like to see in your data before approving the idea of lifting the indoor mask mandate in King County?
Yeah. So we are moving in the right direction towards, liberalizing policies, I think, across the country, as long as things continue to move in this direction. So what I would like to see is lower case numbers, right? Because, I said we're over 300 per 100,000 over 7 days. That's still considered high transmission. So I'd like to see fewer infections in the community And I would like to see our hospitalization rates come down a bit more. We are still at hospitalization rates that are comparable to the peak of just a little below the peak of the Delta, comparable to the peak of the Alpha surge in the spring of 21. And our hospitalization rates now are actually higher, for example, than the peak hospitalization rates that we see over the past 11 flu seasons. So a significant number of people still being hospitalized. So I think that I'd like to see those numbers come down a bit. I would like to see strong confirmation from our healthcare system that they are back to a stable operational status where they can take care of all the patients who need to be cared for, whether they have COVID, cardiac disease, a stroke, or a car accident and need trauma surgery, and that they can do that without resorting to or close to crisis standards of care, but in their conventional or with some slightly modified contingency response. So a stable healthcare system, falling hospitalization rates, and lower case rates. I think we're getting close.
For Dr. Duchin, how do you propose protecting those who have not been able to be vaccinated, such as children under 5 and the immunocompromised individuals?
This question really gets to the fundamental issue of how we work together as a community and help protect one another. We are wearing masks today indoors because we have a high level of COVID transmission in our community, and there's likely someone in this room who's immunocompromised, maybe more than one. We can take care of one another by wearing masks in indoor crowded settings. We need to use all of the layered protections, increase air quality through ventilation and filtration that will make a safer environment for everyone, and continue to get boosted and improve our vaccination rates so that there are fewer cases in the community that will expose people who are at high risk. Infants, young children not yet eligible, immunocompromised people, and the elderly who also remain extremely vulnerable over time, especially if they haven't been boosted.
One more for Executive Team, and then we'll go back to the room. For the Puget Sound Business Journal, they're writing about Microsoft's announcement that it's implementing a hybrid work policy by the end of March and expects more in-person employees. Microsoft is the second largest employer in King County. Is this a decision that can be made safely at this point in the pandemic?
Microsoft has been a strong partner in our work over the last 2 years, right from the start, in combating the pandemic, and I want to salute them and thank them for their leadership. I believe that they have very carefully examined the risk and the benefits of having employees back in the office, and that they're taking every precaution, as Microsoft is well able to do, to make sure people are safe. For our workforce, we are going to be bringing people back in different ways in different departments. In our agency, the executive office, we're going to be able to be in person or remote, be able to work a hybrid schedule. We're equipping our conference rooms with the technology to make sure everyone has access, whether they're on site or not on site. Public health will be doing similar work. And our goal is for each workplace to adopt the right mix of in-person and remote work for their mission and for their employees. And I think that we've learned a lot. The whole society has learned a lot over the last 2 years. And I think some of these lessons are going to resonate long after COVID has receded into memory. It is going to be very interesting to see as we return to the office how we were able to take some of the lessons, really build on some of the lessons that we learned as we all learned how to work with Microsoft Teams and Zoom and so forth, to improve productivity and to improve the working conditions for our employees.
Is there a practical level to this? I mean, if you've got nearly 90% of people who are vaccinated now within the county, it seems like this is an opportunity to take that burden off, even though you're not dropping indoor masking, but it's sort of like, what's the point of asking people to produce these cards if only one person out of 10 doesn't have them?
You're right in the assertion that we cannot wait until the very last person has been vaccinated, and so our public health leaders and we have determined that this is perhaps the best point at which to relax this particular requirement. We need to get people back into the office as well so that we can get our economy going again. And that is not directly related to this vax requirement. Our employee vax requirement remains, but we, the city, private employers really want to get our employees back interacting in person. And I got to tell you that as a resident of the city and county, I want those employees visiting our local restaurants and helping our economy get back on its feet.
Last 10%, 11%, 12% of folks, after having vaccines been available for a year and almost universally vaccinated for nearly, or available for nearly a year, do you feel that those folks are just not, you're never going to get them? You're never going to get that last 10%?
My answer to that would be as good a guess as yours. The public health officials probably have a little more scientific basis, but I would say that that last 10% is still going to continue to be a disproportionate share of those who are infected, hospitalized, and sadly those who succumb to this virus. And I would encourage them, even if they've waited this long, to please take advantage of the simple solution that's available to get vaccinated, protect themselves, their families, and all the rest of us from this virus that is continuing to circulate in our community.
Keeping a county mask mandate after the governor rescinds the statewide.
Again, that will be something where we rely on the advice and wisdom of our public health officials. We have done our best throughout this to stay synced up with the state of Washington. Seattle and King County have worked very hard to stay together on these things because, for one thing, it's just difficult messaging, right? You want to make sure you're able to, as much as possible, communicate one message throughout the television market, for example. So Dr. Duchin may be able to weigh in on the appropriate point at which we relax different mask mandates. But I would just say there are, as Glenn was saying, there are practical considerations about when to impose a requirement and when to relax.
I have one more question. So for that, talking about vaccination rates, we understand the underserved communities and immigrant communities, particularly those that live in the South King County. I'm in Somali Bridge, which is a community ethnic area. We know their vaccination rates are lower than the other communities. And now the vaccination approval and also the mask mandate being lifted, what is the strategy for those communities so that they can continue to be part of the fight against COVID-19?
So we've conducted a lot of outreach, including through our Pandemic and Racism Advisory Board. And it is a fact that some communities within King County have lower vaccination rates, and it is incumbent on us. It is a moral imperative that we continue to reach out with community-based organizations that have direct relationships with those who still need to get vaccinated, to provide the resources for community events so that we can bring people together with those they trust to get vaccinated, to make sure that we are doing everything possible to overcome whatever has kept folks from going out and getting vaccinated, with its access to the vaccines, whether it's concern and a lack of accurate information, or simply not having a trusted partner to help them walk that process. We are going to do that. We're going to continue to do that. We believe that is our obligation. And thank you for the work that you do and continuing to help get the message out.
So, like up on Capitol Hill, a lot of neighborhoods here, like bars and small restaurants, it's already funky with people who, assaulted, with people at the door, talking crazy to them, everything over, the vaccine card. So have you guys thought through like what's going to happen after March 1st when there's a restaurant or a bar that's still saying that they want to see a vaccine card? You got people here who are now like, hey, it's not required anymore. It's already a hostile space, is what I'm saying, in a lot of places around these cards.
I understand that's a very difficult issue to deal with, of course. A business has a right to require that people coming in are vaccinated, just as it has a right to require that they wear shoes and a shirt. and folks are not within their rights to challenge or try to intimidate that business that's trying to provide their employees and customers with that level of certainty. It is going to be ultimately a challenge for all of us to make sure that those kinds of requirements in individual businesses are respected. But again, as I said in my opening remarks, we support those businesses. If they choose to provide that assurance to their customers, their employees, we, by all means, want to give them our backing.
What do you think of testing sites? We're going to keep some open? Or?
So, questions about testing sites. Jeff, I'm going to want you to weigh in on this a little bit. Clearly, testing has been a critical component, particularly during this Omicron upsurge with so many infections happening. And I want to commend the federal and state government and our own public health agency for making tests, home tests, much, much more available to folks. It is providing a lot of confidence. It's also allowing people to do the right thing when they find out they're infected, to stay home and avoid infecting others. I do think that we're going to have to continue to have, even beyond the traditional medical system, have some testing capacity out there for people to be able to check if they know they've been exposed, or if they're having symptoms that they are concerned may be a COVID infection. Dr. Duchin, I don't know if you want to weigh in on the availability of testing as we move through this.
Thanks for your question. It really gets at the uncertainty about what to expect with respect to future surges. We do anticipate that there will be a need for testing in the community. We're trying to create a plan now, as we are with so many other aspects of this pandemic, to pivot from this initial emergency response to a long-term, more sustainable strategy. And I'm trying to understand how much the public health department needs to do, how much can the regional healthcare system absorb. We have had fantastic partners in Seattle Fire and first responders, with our community testing sites. But what we're hoping actually is to see that volume drop and the demand drop. And we will try and meter the availability and the resources that we're putting into the need, which is expressed by the demand. We all know that there's a lot more availability of home test kits now. I certainly hope those become more widely available and are provided either at no cost or low cost for a long time, so that people have that information on which they can base good health decisions. But we are in the process of developing our strategy now for long-term testing as well as vaccination. These giant sites, are not going to be needed forever, large mass vac sites and so on. So we're challenged a little bit by not knowing exactly what's going to happen, but we think that over time, the need will be less, and we'll try and provide the appropriate amount of access to the need in the community, not only by King County government and public health, but through our healthcare system partners. So, for example, we were able to transition one of our testing sites to our University of Washington colleagues already. So things like this will, probably continue to happen.
Just want to thank everyone for your excellent work in getting accurate information to the public throughout this so far 2-year process. It will have been 2 years just in a couple of weeks. We're not through yet, but we're optimistic. And if we continue to do all the things that Dr. Duchin has recommended and that our state health department has recommended, I think we'll continue to prevent infection, save lives, and get our community back on its feet. Thank you so much. Thank you.